Yes, sir.
You are so kind, Saurabh. Thank you very much. And this is probably a continuation of the previous speech by Asma. And I am so thankful and grateful to my friend and brother, Dr. Benshi, for involving me in this very important panel. And probably I am the only speaker from India, and all the others are international speakers in this particular session. So this is more of a history, and this is the journey. And probably I am selected because I am in this journey from what happened. Yeah, I am in this journey from beginning onwards. So that probably is one of the reasons why I am here. And present view. So here there is no present view. I clicked on the present view. Yeah. Okay. Fine. Can you have the present view here also? Okay. Thank you very much. And let us go back to 2004, and that was when Medtronic launched the refurbished insulin pumps in India. So those were the 508 pumps. Those were there for some months, I believe. And soon in 2005, the Paradigm pumps were launched in the country. It is stuck. Okay, this is moving. Okay, now it is Paradigm. Earlier it was a refurbished pumps. Okay, so and this is a picture of a doctor. And this is a picture which appeared in the front page of the most popular newspaper in our local language, the largely circulated newspaper, and simultaneously in a national daily. In 2005, when this minister decided that the pump should go public, because since he experienced the benefits of using a pump, and this was a totally different experience for him. He believed that he himself being a doctor, because he is an MBBS doctor, he believed that he should go to the media and announce it. And that probably led on to huge publicity for insulin pumps in the country. And the journey continues, and this is the story of a 17 years. I am not going through the story of a type 1 or a type 2. So this is not the classical patient. This is a girl who had a fibrocalculous pancreatic diabetes, FCPD. And in 2008, she was 39-year-old when I first met her. And we started her on basal bolus therapy, which is so difficult to treat because of the fluctuations in the glucose values and highly insulin sensitive scenario. And this is in 2008 when we switched over to the 722. So I used to tell my students, we used to have the real-time devices for glucose monitoring in India from 2007 onwards. So real-time glucose monitoring is not a new technology in the country. It has been there for quite some time. And in 2016, she upgraded to 640G. So every time we have a new device in India, we were believing that that is the artificial pancreas, and that is probably one step ahead, and we are soon reaching the so-called complete automation. However, this was a game changer. 780G was definitely a game changer, and if you look at the TIR, and that is when the TIR methods became more popular, and we were aiming for more than 70%. So when you compare 780G, it looks thin and flat and beautiful with UDP. So when you compare 640G, in 640G, glucose is all over the sky. But with 780G, it was again a dream come true. So we never ever imagined that this can be a possibility in uncontrolled diabetes to have this much flatter curve for a person with uncontrolled glucose. I was thanking Benshi for putting me in this panel. And this is hemoglobin A1C over the years with all the three devices. And this is a diagrammatic representation of TIR with the three devices. And it is only with the 780G this has been possible. Because reaching a target of more than 70%, which is our dream, or more than 80%, has never been possible with the earlier availability. Of course, there have been multiple advantages, and I even had a girl met me before yesterday, before I left, and she was on a conventional insulin pump for a long time, for almost 14 years, and she didn't have the resources to procure a 780G. But she said that she cannot go by the multiple daily injections because for the last 6 months she is on multiple daily injections, and she said that with multiple daily injections, I feel so tired. But with continuous subcutaneous insulin infusion, even without a sensor, I feel very, very active. So there is a difference in CSII even without a sensor. And this is an interview, a very recent one. Probably many of you could have seen it in my YouTube channel. And this is with Parthakar. When we were having a conversation on how we can popularize, because he has been so successful in the United Kingdom in having this delivered to everyone. So in the UK now it is a rule that everyone with type 1 diabetes should be given an automated insulin delivery device. And considering these two examples, India against the United Kingdom, in India, 45 healthy years of life being lost in a person with type 1 diabetes, and even before AID, in UK, it was only 15 healthy years of life being lost in type 1 diabetes. So we were actually discussing on the possibility. So he was making an argument that the economy in India is actually almost same or similar to the United Kingdom, with or it is at par with the most of the European nations, and so we can do that. We can do that once we can convince the authorities. But yesterday, Devashish and all of us, Dr. Benshi, did a program here. We were in an ad board meeting discussing about AID. Some 10, 12 of us from different parts of country and from outside. So we were making a suggestion that it is not to convince the authorities. Dr. Asma might also agree with me. It is to convince the doctors, especially the doctors in some specialties, doctors in cardiology, neurology. So they should also be convinced of using this and how superior the device is when compared to the conventional insulin. And the challenges are multiple. The challenges are multiple when you are managing type 1 diabetes, and this is a challenge which is encountered by the patients, encountered by the parents with diabetes, and we have been in this space for more than 27 years now. And recently, we were brainstorming as a group, and we launched a new project by name Dreams. And this has been launched by the celebrity film actor Mohanlal, both online, offline, one-to-one education, webinars, and also Dreams practicals, visiting every city in our state of Kerala. And we were recognizing. So where is the gap? So in the community, we came across many people. So there are more than 4,500 from our state with type 1 diabetes. So there are many children with an A1C more than 14%. Whereas in our clinics, we can maintain even with multiple daily injections with accuracy 24/7 support via the telemedicine protocol. We were able to bring it on an average below 8. Of course, with AID, even below 6.5. So we were remembering the earlier days from how we traveled across, and Dr. Debashish, who was chairing the session, so he was actually, we together, remember those days, Kade Batino, Dr. Sadishka, so we used to travel across the length and breadth of the country, India, multiple cities, conducting insulin pump workshop, empowering and training the doctors. That was during the first 10 years of introducing pumps in India, from 2004 onwards, publishing the guidelines in international journals, making it more popularized. And this was actually the guidelines originally was meant for the legal reasons. So there was a huge protest even from the doctors, especially from some specialities. Why you should be using such a expensive device when the syringes and pens are available? Why should you use that? It is absolutely useless device. And so we are in between, again, we publish these guidelines in the physician's journal, JAP. And periodically, when there is an upgrade of the device, we were also sharing our success in the newspapers, because that was also a necessity for the survival of technologies and to make doctors, our own fraternity, aware of the benefits. And we are so grateful to Medtronic as a team. Dinu is here. So we are so grateful to Medtronic that this is the only pharmaceutical or the device manufacturer, more than 20 years of its presence in India, and been very consistent with launching almost all these years. Why I am telling this? Because no other device manufacturer, no other AID is now currently functional or available in the country. And the biggest innovation from Medtronic, that was the 2022 launch of 780G. And the experience of everybody is familiar with this. And this is when an algorithm and a sensor is integrated and the pump has become automated. And that is the terminology which has replaced the earlier artificial pancreas. And now we call it AID, or automated insulin delivery, with basal changing almost every 5 minutes. Even an option for auto correction boluses. If it has already reached the maximum basal, it will deliver an auto bolus. And but uniformly, the feedback from all the patients, they have slept peacefully for 8 hours, and this has happened maybe first time after I have been diagnosed with a type 1 diabetes. Everybody will have the same statement. So this is not a pump. So never confuse 780G or an AID with an insulin pump. This is not a pump. So this is so different from the ordinary standalone insulin pumps, and this is entirely different from the sensor augmented pumps. This is a huge difference, and this is a path-breaking, transforming innovation from Medtronic. And this is how the publication looks like, and this is the first 25 patients on INID from our center, 83% time in range, and negligible time below range is 2% time below range. And this is again exceeding the recommendations, because in the recommendation you can even have less than 4% time below range. And this is a old publication with the next speaker, Bob Vygotsky. So both of them are good friends, Warren Lee and Bob Vygotsky. And with Bob, and this is the CDM, we actually reveal the fact that nocturnal hypoglycemia is unrecognized, extremely common. And unrecognized nocturnal hypoglycemia could be related to even, and with the new systems, and this is from the recent publication, these are the feedbacks from the patients. More consistent optimization of the glucose level, slept after so many years of worries, slept peacefully after so many years of worries. It is waterproof. And again, hypo-free nights, and that is a dream of every parent taking care of a child. And this is a level of satisfaction 5 out of 5. And this is something which we are consistently probably doing, and this is APTD Asia. Very recently, a couple of months back, from 3 centers in the country, from Ahmedabad, from Dr. Benshi, from Mumbai, this is from Dr. Manoj Chora's center, and this is from Trivandrum, from our center, on pre and post advanced hybrid closed loop system. Look at the average reduction in the glucose, and this is the reduction in the hemoglobin A1C from 8.8 to 7.1 percentage. But the difference is, if you look pre and post time in range, it is incredible data in type 1 diabetes, 44% to as high as 76% time in range, and a significant improvement even in the glucose variability from 40 to 32.23. Acceptable now. And this is another story, and this is a story of a girl. So many patients are with me like this, hundreds of them. And for her, I deployed a ordinary pump when she was 6 years old. And the family was so supportive in her journey, that they were upgrading. Once a new pump or a new device or a new technology is available in the country, within a week they used to upgrade, and now she is on 780G with an A1C of 6.9%. So she is celebrating. So these are individuals who are having a normal life, and they don't have any complications. And no wonder Medtronic has celebrated 1,500 780Gs in the country. And that is again something which has happened for the first time after 21 years of Medtronic diabetes in India. First time for a device, 780G, they have reached the magic number of 1,500. And the journey continues, and this is a journey with 780G. And this is one of the reasons why during the DTEC meeting recently, we honored Bob Vygotsky from the United States, heading Medtronic Global, and she is again the past Endocrine Society president as well, for providing us the best, because the best in technology is whatever is available at that point of time. So Medtronic was providing that to India. And now the dream is to provide 780G to all eligible type 1 people. And as doctors, it is our responsibility. It should be very expensive, but we should have open discussions with the patient, even if they are not affordable. They might find a reason, or they might find a solution, procure it. We don't know. But it is our responsibility to have open conversations on the availability of a life saving device which can provide them a life similar to somebody without it. And this is an invitation to all of you for the biggest convention in the country, RSSBI 2025 in Kochi in Kerala. And of course, for the JPF this year, 13th annual convention. Thank you very much, my dear friends.